The goal of any medical practitioner is to return their patients to a healthy, active, pain-free lifestyle. The quality of life for patients that suffer from low back pain is often diminished because of the pain resulting from their condition. You are not alone if you suffer from low back pain, as it is estimated that over 80% of Americans will experience low back pain at some time during their lifetime. A new technology called decompression therapy has achieved remarkable results in relieving low back pain and in healing herniated discs. Decompression therapy is the centerpiece of the DRS system, model ABS. The ABS has helped thousands of people suffering from low back pain regain an active, pain-free lifestyle.
I had a lot of pain in my lower back, and every once in a while I'd have a pain in my left leg, and it just never seemed to go away, and the doctor kept prescribing more and more muscle relaxers. And finally I decided to try the ABS machine, and after just a couple of treatments, the pain in my left leg is gone, and my lower back feels terrific.
Decompression therapy was developed through years of clinical research and is the result of the combined efforts of neurosurgeons, orthopedic surgeons, and biomedical engineers. Following the successful treatment of more than 8,000 patients, FDA clearance was issued in April 1997, and the therapy became available for medical use in January 1998. The ABS system incorporates the latest in decompression technology and effectively relieves the pain and disability resulting from low back or disc injury. The ABS system repairs damaged discs and reverses the dystrophic changes in nerves through the non-surgical, painless decompression of the disc.
To fully appreciate the ABS system, a prospective patient should understand the concept of decompression, which is not that difficult to understand. In a damaged disc, the flow of oxygen, blood, nutrients, and water is restricted. Decompression reduces the pressure within the damaged disc, allowing the water, blood, oxygen, and nutrients to flow again into the disc, effectively healing the disc from the inside out. Your spine consists of a column of 24 movable bones known as vertebra. In between each vertebra is a fibrous covered disc with a jelly-like center. Each disc acts as a shock absorber within the spine. Sometimes these discs dislodge or become damaged as a result of trauma or the aging process. This phenomenon is known as disc herniation. Disc herniation restricts the flow of blood, oxygen, nutrients, and water to the disc, which is essential for a healthy disc. Decompression, as achieved through the ABS, reduces the pressure within the disc, which reestablishes the flow of blood, oxygen, and nutrients into the disc, which effectively heals the disc from the inside out. Decompression is painless and is non-invasive. The ABS achieves decompression through computer-controlled tension directed to the exact disc that is damaged, in addition to positioning, weight variations, and angle of pull. In a recent clinical study, treatment on the ABS was shown to be effective at relieving low back pain in 86% of the cases studied.
As has been stated, treatment on the ABS is non-invasive and is pain-free. When you are placed on the ABS, you are custom fitted with upper and lower harnesses. Your knees are elevated and the O-ring is attached to the base unit. The harnesses are attached to the control system. Pursuant to instructions from your doctor, one of 5 computer programs is selected, and with precise and painless computer-controlled tension, the specific damaged disc is gently decompressed to reduce the pressure inside the damaged disc. You are given a patient interruption button through which you can interrupt the treatment if necessary, and the ABS is equipped with headphones so you can relax and listen to music during the treatment. Again, the specific disc or discs that are damaged are isolated and are treated specifically. Decompression of the damaged disc allows the blood, oxygen, and nutrients to flow into the disc, which heals the disc from the inside out. A typical session takes approximately 25 minutes, and the recommended course of treatment is 20 sessions. Although you may feel relief after 1 or more sessions, it is important to complete all 20 sessions in the protocol, as the objective is to actually heal the herniated disc and not just relieve the pain.
This is a very good MRI showing some problems. This patient's a 51-year-old man, 52 actually at the time of this shooting. And what we see here, the patient is a president of a hospital in Philadelphia who comes here with 1.5 years of back pain. Okay, it's a nice fluffy disc, 52-year-old guy, and we can see again the bones on either side. We can see an attacked end plate. We can see the annulus fibrosis. We can see a nice dark tire appearance with the fluffy nucleus pulposus in the center. And this is really beautiful. Some people would argue a slight bulge, but we think that's really pretty normal. This is really a pretty nice disc. And this is normal, and it's just fine for a 52-year-old guy. We look up here, we see L2, L3, and we see that's also quite normal, really, really fine. You see good disc hydration, good disc height. As we go down, these disc spaces should get bigger and bigger, and we see here's the problem. This is L3-4, which we know he injured about 1 year or so before we saw him, 1.5 years. He had physical therapy for 9 months. We explained to him that we thought this was the acute disc injury, and we took this MRI and we saw the disc injury at 3-4, which was similar to an MRI he'd had about 1 year ago, perhaps a little more degeneration here. And for various reasons, including his symptoms and electrodiagnostic studies, we were pretty sure this was the bad boy. This was the disc that was hurting him. Now, this is part of where the differential diagnosis comes into play, because you see on the MRI, there's 2 bad discs. There's 3-4 and 5-1 with 2 beautiful ones, and actually the ones higher up were normal also. So which one is really bothering the patient? And that's where you have to be a doctor. And as you see, the angles are somewhat different. The angle of distraction for 5-1 is different than it would be for 3-4. He had 11 treatments with us. We recommended 20 for a disc like that, but he had 11 treatments, and he was done. He felt better. He didn't feel it was worth driving here anymore. We were fortunate enough to persuade him to have one more MRI done after the treatment. This was done February 2nd of 2000. The next MRI was done March 10th, so it's about 5-6 weeks later in 2000. What we can see is, first of all, look at the bad discs. The bad discs, the ones that we thought had lost some disc height, were bulged or protruded or herniated out a little bit, and had also lost signal, showing that they were damaged, they were starting to dehydrate. The bad disc had actually improved in hydration status because of increased signal in T2-weighted sequences. The bulge or herniation posteriorly was actually much less, which was very nice. The disc height had improved. What we do is enlarge the films, and you can measure with a micrometer the disc height at various levels, and you see he actually did have significant increase in disc height, looking at it in percentage of the vertebral body that's adjacent to it. So here we have improvement in the disc height, improvement in the herniation, and we think, just as importantly, improvement in the hydration status of the disc. Begins, and this is why we did the treatment. The real fun begins when we sit back here a little, we look at the normal disc. The normal discs actually got better. We believe that the normal discs show better hydration, some improvement in disc height, and there was no herniation to fix. And interesting here, so L5-S1, we see a little bit better disc height, not much. We see a tad better hydration status. The herniation is really not significantly changed, and we believe that's because the distraction angle in this case was maximized for L3, L4. We talked about changing the distraction angle for different disc levels, and that's again why we're aiming at 3-4. That's why it makes a difference with the new distraction technologies. You've got to know what you're treating. You can't just throw everybody into the same protocol. So this was a very successful guy. To follow up, this was March 10th. This was taken 2000. Today is March of 2002. He hasn't been back here. The patient is still doing well. He was an outdoors enthusiast. He really wanted to go fishing and hunting, and he couldn't do any of those things because of the pain and disability. The July 4th, after these were taken, he redid his patio and lifted over 2 tons of bricks and had no problems. He went fishing that summer, hunting the next year, and got a big buck, and et cetera, et cetera. So he's a very happy guy. And as far as follow-up, it's 2 years. We still haven't seen him, and reports are he's doing well.
I had a protrusion of a disc that was treated with steroid medication, and that worked for a while. And then a friend referred me to a doctor with an ABS system, and prior to my first treatments, the pain in my back and my leg were excruciating, and I could hardly bend over. And after the treatments on the ABS system, the pain in my back and my lower right leg were gone, and I had greater flexibility than ever. I highly recommend the ABS system.
The ABS achieves an over 85% success rate at healing herniated discs and relieving low back pain through decompression of the damaged disc. As has been evidenced in several clinical studies, the ABS system has achieved remarkable success in every clinical study that has been conducted on the technology. Several neurosurgeons have indicated that, as the success rate is so high, physicians should have an ethical obligation to try decompression therapy with their patients prior to even contemplating surgery. Back surgery is invasive, requires a long rehabilitation time, and has a very low success rate. In one recent study, less than 7% of those who had back surgeries considered the procedure successful.
I was diagnosed with a herniated disc and suffered with the pain for over 2 years. I tried everything short of back surgery, but just after 3 treatments on the ABS, my pain was greatly reduced. After 20 treatments, I've been pain-free for over a year. The ABS has given me back my life.
Recapture a pain-free, healthy, active lifestyle through treatment with the ABS system. The ABS system is a non-invasive, extremely effective alternative to back surgery with over an 85% success rate at healing herniated discs and relieving low back pain. Ask your physician today if your condition is eligible for treatment on the ABS, and if so, ask how you can begin treatments with the ABS system today. Recapture a pain-free lifestyle through treatment with the ABS system.